Okay, boys, what did we do last time? Yes, boys. Anyone? Yes, boys. Can you hear me?
Yes.
Okay. So have we started CHD?
No, sir.
Chronic heart disease.
Yes, coronary heart diseases. Did we start these or not? Okay, but let's start learning about the coronary heart diseases. Now remember one thing. Wherever you hear the word coronary, it simply means related to the circulatory system. Okay? And related to the heart as well. Now, first disease which we are going to talk about, that is the atherosclerosis. Now, what is atherosclerosis and what happens in the atherosclerosis? Boys, let's see. Let's suppose that this over here, this is an artery. Right, boys? Now, you guys know I have taught you about the blood vessels. Now, arteries, they have narrow lumen. Do you guys remember this or not?
Yes, sir.
Who will tell me what is the meaning of lumen?
So the space in the blood vessel through which the blood
Ve-
passes.
Very good. The space in the blood vessels through which the blood passes, right? Now, what happens during the atherosclerosis? Those people who drink, or you see, who consume a lot of fatty foods.
Sir, we have done this. We did this.
So I was asking in the beginning, no one was answering that we have done this or not. Okay, so we did talk about then about the thrombus and embolus, right? The blood clot. The thrombus
Yes,
is
sir.
called as the blood clot, and the embolus is the moving blood clot. And we did talk about the heart attack as well. It means.
Yes, sir.
Yes, sir.
Okay, boys. So today we are going to talk about angiography and then angioplasty. Now I would try to show you guys a video as well, but first let me explain this, okay? Now guys, look here. Let's suppose that this is a model human body. Now over here is the heart. Now guys, from here the aorta comes out and then this comes down. Now what is this? This is the descending aorta. Now if you guys remember, we learned about the aorta like this, right? Now when this descending aorta, it reaches down near the legs, it divides to form two blood vessels, and both blood vessels, they go into the both legs. Now boys, what do we do now in the angio? Now remember that angiography is a test, while angioplasty is the treatment. Most of the times most of the times nowadays doctors perform angioplasty and angiography at the same time, right? But sometimes they only perform the angiography. Once they find the problem during the angiography, then they will only perform the angioplasty. Now what is that? Now let's see. Now if you guys remember yesterday, you see last time we have talked about the atherosclerosis, and we have talked about that atherosclerosis is when the blood vessels they become narrow from the inside. Now let me quickly show that you see this is the blood vessel, and what has it become? It has become narrow from the inside. Now this narrowing is either because of the, you see, deposition of the cholesterol and fats, and also because of the deposition of the minerals, and also deposition of the cell debris. Now was another thing, if you guys remember, I taught you last time that there is this coronary artery. And I also taught you that this coronary artery, it divides into right and left coronary artery as well. Do you guys remember this or not?
Yes, sir.
Yes, sir.
And I also taught you that this coronary artery, it comes from the aorta. It comes from the aorta. Now, guys, as this is the descending aorta and it is coming directly from where? From the heart. Now, what do the in the angiography the doctors do? The doctor will make a cut over here. After making a cut over here, now this cut will not only be in the skin. This cut will also be in the this femoral or iliac artery. This is called as iliac artery. The artery which is going towards the leg is called as iliac artery. So there is this cut into this, you see, artery, and then the doctor inserts a guide wire. Now, what is the meaning of guide wire? Now, it's a very thin plastic wire which the doctor inserts, and that wire then goes where? Into the aorta. Now, the doctor is pushing this wire up in the aorta. Now, as you guys know, that you see this aorta is going back where? Into the heart. This descending aorta is going back into the heart. So eventually it will happen, it will reach where? It will reach in the coronary artery. Now, once this guide wire, it will reach into the coronary artery. Let's suppose that this was the aorta, and in the aorta, this is the guide wire. Next step, what do the doctors do? They will insert a catheter above the guide wire. The question is, what is the meaning of catheter? What is catheter? A plastic tube is called as a catheter. Now, guys, tell me one thing. Whenever you get some diarrhea or some problem, you go to the hospital, the doctor puts drip, and the liquid of the drip goes into your blood with the help of a plastic tube. Right, guys? Have you observed that?
Yes, sir.
Now, that plastic tube is called what? Catheter. That plastic tube is called as catheter. So what the doctor will do, will insert, you see, this plastic catheter. Now, The job of the guide wire is that it will take the catheter to the coronary artery. It will take the, you see, this catheter to the coronary artery. So what will the doctor do? Will keep on pushing this catheter inward. Now what will happen? The catheter, you see, it will keep on moving like this up. Got it? Means that now the wire is inside of the catheter. Now where the wire is gone, the catheter will reach over there. Eventually the catheter will reach where? In the coronary artery. After the catheter has reached into the coronary artery, the doctor will pull out the guide wire. After that, the doctor will pull out the guide wire. The job of the guide wire was to guide the catheter into the coronary artery. Now, doctor wants to know that which coronary artery has atherosclerosis, in which part of the coronary artery there is narrowing of the blood vessels has happened. For that purpose, the doctors then they inject a liquid over here from here, a fluorescent liquid. Now, the doctors, once they inject the fluorescent liquid in it, now with the help of ultrasound and you see x-rays, they keep on detecting that in which part of the heart that liquid is flowing freely and which part of the heart the liquid is not flowing freely and it is going less. Now let's suppose if less liquid is going to this side, so it means that this side or the, you see this left coronary artery, it has some blockage or it has some kind of, you see narrowing of the blood vessel because of the atherosclerosis. Now what has the doctor found? They have find out the problem that this left coronary artery has become more narrower because of the atherosclerosis. Now next step is that they want to fix this problem. They want to remove, you see, they want to make it wider. They want to make it wider. The question is how they will make it wider. For that purpose, they have this angioplasty, which I told you is the treatment. Now, angioplasty is the process in which they put stent in the blood vessel. The question is that, sir, what is a stent? Now, as a stent, it is made up of usually titanium. Otherwise, you guys have learned about titanium in the chemistry. That titanium, it is one of the hardest metals and it is non-reactive and hardest metal. Remember that or not, boys?
Yes, sir.
Now, this stent, it is made up of titanium and it is what? It is actually a gauze. Now, do you know what is the meaning of a gauze? Anyone? Does anyone know what is the gauze?
So gauze is used under beakers.
Where?
When heating them under beakers.
Very good. Gauze is used under the beakers. Gauze is also present on our windows as well to prevent the insects coming inside. Is it true or not, boys?
Sir, metal
Yes,
packing
sir.
tube.
Right? So this
Yes.
is a round gauze. A stent is actually a round gauze. Understand? And it is dipped in heparin. Now, boys, in the last lecture, I did tell you what is heparin. Who will tell me? Who remembers what is heparin? Yes, boys. No one remembers? Now, I told you that heparin is a hormone that is produced in the liver and it prevents the blood clotting. It prevents blood clotting. Now, for the angiography, so angioplasty, now same catheter is there. Now, interestingly, this catheter, it has a balloon on its tip. And above this balloon, they place this what? Stent. Now, then what do? They push this catheter with balloon and with stent above the guide wire. Again, boys, this is the guide wire, so they will push it. And eventually what will happen? That this catheter with balloon and with this stent will reach where? It will reach into the area where there is atherosclerosis in the coronary artery. Once it will reach there, then the doctors, they will pull out the guide wire and then they will pump air into this balloon. When they will pump air into the balloon, this balloon, it will inflate. And when the balloon will inflate, now as it is a wire gauze, now it means that these wires, they can stretch, right? So what will happen? That these wires, they will stretch, and what will happen is, as it is, you see, metals are malleable. You have learned about this or not, boys, in chemistry?
Yes, sir.
Right? So these, you see, this is metal, and you see these are gauze. Now the wires of the gauze, they can separate from each other. So what will happen? They will push the blood vessel apart, and when the blood vessel will be pushed apart, then what will happen? Then the place from where there was this blood vessel had become narrow, now it has become what? Wider. Now the blood flow will become normal. Understood? Now, guys, quickly, I'm going to show you guys a video of the angiography. Okay. All right.
Yes, sir.
Coronary angioplasty, also called as the percutaneous transluminal or balloon angioplasty, is a treatment procedure to restore the blood flow in the narrowed or blocked coronary arteries caused due to plaques or blood clots. Most coronary angioplasty procedures last between 30 minutes to 3 hours. Once the patient is admitted, his heart is monitored and is given an intravenous sedative to relax the body. A needle is inserted through the wrist into the radial artery. A guard wire is then passed through the needle and is guided through the arterial system up to the heart. A flexible catheter is slipped over the wire and threaded up to the heart. This is monitored using a continuous X-ray imaging device called fluoroscope.
Now, guys, look here in this diagram, in this picture, what he is using which artery? he is using the subclavian artery. Remember, I taught you about the subclavian artery, the artery which goes from the aorta to the shoulders and arms, right? Remember that?
Yes, sir.
So remember that you both iliac artery can also be used and subclavian artery can be used.
A needle is inserted through the wrist into the radial artery. A guard wire is then passed through the needle and is guided through the arterial system up to the heart. A flexible catheter is slipped over the wire and threaded up to the heart. This is monitored using a continuous X-ray imaging device called fluoroscope. At this point, the guard wire is removed and the tip of catheter is positioned to enter the coronary artery. A special dye is injected which allows the fluoroscope to take X-ray images of the arterial interiors and help in...
Right, boys, I told you that a special liquid is injected, and when that liquid flows, now where there will be blockage or there will be narrowing, so if there is blockage, no liquid will flow on that side, or if there is narrowing, then less liquid will flow from that side, and with the help of X-ray images it can be detected.
Identifying the position of the block. This is called angiogram. Once the blockage is identified, a flexible guard wire is inserted into the artery vessel, followed by a balloon-tipped catheter over this wire to position itself at the site of the blockage. Rapid inflation and deflation of the small balloon pushes the vessel wall out, re-establishing the flow of blood in the artery. After the blocked vessel is reopened, the deflated balloon catheter is withdrawn from the artery. The same treatment procedure is repeated in the case of multiple blockages. Most patients may also receive a coronary stent, which is a small tube made of wire mesh designed to keep the artery open once it has been treated. A collapsed stent is placed over the deflated balloon catheter as it is inserted into position. When the balloon is inflated, the stent expands and locks.
Yes.
Sir, this stent is of metal, right?
Yes.
Okay.
Titanium. Okay.
Okay, sir.
Itself into place. The deflated balloon and catheter are withdrawn, leaving the stent behind to hold the artery open permanently. Post-treatment, a pressure bandage is applied over the radial artery to prevent bleeding. One will need to lie down for several hours, during which signs of bleeding or chest pain will be monitored. The patient may either be discharged on the same day or after an overnight stay at the hospital.
Alright, boys. Did you guys get the idea?
Yes, sir.
Yes, sir.
Alright, then what is 12 minus 3?
Now, let's see if this is a bit useful.
Hello and welcome. My name's John. You probably have a lot of questions about your procedure and what happens now. I understand because I have a stent too. I remember asking, how will my life be different now that I have a stent? What is a stent anyway? Why do I need one? What happens next? In this video, I'll be your guide to some answers. We'll go through things chapter by chapter. So if at any time you'd like to repeat a chapter, just select the chapter you're interested in and the chapter will play again. Let's get started. The workings of the heart are a marvel. It is about the size of your fist and sits just to the left of the middle of your chest. The heart's job of providing the steady flow of blood to the head and body is vital. Blood delivers oxygen and nutrients, and removes toxins and carbon dioxide to keep your body healthy. The heart cannot do this job alone. The heart needs oxygen and nutrients to do its job. Coronary arteries supply the heart muscle with oxygen-rich blood necessary to keep the heart healthy and strong. The coronary arteries are like pipes. They supply blood to the heart muscle. Like a pipe, coronary arteries can get clogged over time with debris. The debris that can clog an artery is called plaque. Plaque is a sticky substance made up of cholesterol, fatty deposits, calcium, and other materials in the body. The plaque buildup may break open, what doctors call rupture, and a blood clot then forms over the rupture site. When that happens, the blood clot can partially or completely block the coronary artery. As a result of this blockage, less blood flows through to the heart muscle, starving the heart of the oxygen and nutrients it needs. As you'll see in the next chapter, this causes the chest pain or other symptoms that you may have experienced. Like the rest of your body, the heart needs blood flowing through it to stay healthy. When the heart is deprived of blood, because of a plaque rupture and blood clotting in the coronary artery, the result is a condition doctors call acute coronary syndrome, or ACS. You probably experience some of the symptoms of ACS. Severe chest pain or chest pressure are common. There are several types of acute coronary syndrome. One type is called unstable angina, which is a condition where a patient feels unexpected chest pain when resting. Unstable angina can progress to another type of ACS called a heart attack. During a heart attack, also known as myocardial infarction, part of the heart muscle dies because of lack of blood reaching it. Acute coronary syndrome is a life-threatening condition that requires urgent or emergency treatment. If a doctor suspects ACS, he or she will perform several tests to find out how the heart has been affected. A blood test will be done to see if heart damage has occurred. Another test, called an electrocardiogram, will be performed to measure the heart's electrical activity. A doctor is also likely to perform a test called an angiogram. This test examines the inside of your heart's blood vessels to determine.
Okay, boys, we'll continue from here to inshallah in the next class, okay?
Okay, sir.
And then we'll move forward as well, inshallah. Okay, boys?
Okay, sir.
Take
Yes,
care
sir.
and Allah Hafiz and good luck for today's exam. Which paper is today?
Islamic studies.
Islam.
Okay, boys. Allah Hafiz.
Allah Hafiz.
Allah Hafiz.
Allah Hafiz, sir.
Allah Hafiz.